Welcome to Health IQ, a podcast from the Quay County Health Council. In this podcast, we are exploring a variety of health topics that affect our community and probably yours too. We are not professional podcasters, but volunteers that have a passion for wellness. We will share practical ideas and resources for people with limited access to services, and we have some fun tips to help you and your family stay healthy and well. Increase your health IQ as you listen to our members as they talk and share with experts and others about the health matters that matter to you.
Health IQ, Getting a Good Start, Episode 11, Navigating Vaccines.
Welcome back to this episode of Health IQ Podcast. Today we are visiting with a healthcare professional about an important topic for parents and soon-to-be parents. Joining me today at the table is Lindsy Foust, a Certified Nurse Practitioner with Presbyterian Medical Group here in Tucumcari. If you're in Tucumcari, you don't recognize that name. It's the PMG Clinic in the hospital parking lot. Our crew today is Joyce Runyon and Bobby Hockaday, and I am Brenda Bishop. Lindsy understands the challenges that many of us face in our area in obtaining health care for this remote rural area, as she was raised on a family ranch about 40 miles from here. We are excited that you've moved back to Quay County along with some of your family members and have obtained your nurse practitioner degree and is bringing quality health care to Quay County. When I was raising my children, I didn't think much about vaccines at that time. It was just like normal. Those were, they were there. They'd been here a long time. You had your little card and you went to the doctor and it said go at 2 months, at 4 months, at whatever, it said. And you just did that and you didn't think much about it. But then as our life got busier and all, and I got that letter in middle school that said my kid needed more shots, I was like shocked. What do you mean we need more shots? And now, as I look at the charts, I find them very confusing, and we tell people to go CDC website and read that, but it is so confusing. So what is your best tip for helping parents even navigating the time schedule for vaccines?
Yeah, so I think that's a really good point, and I think key is finding a pediatrician or a family practitioner to establish with as your primary care provider, and they will help guide you through those well child checks and how to stay on top of the immunizations.
Yes, so getting somebody and maybe hopefully locally so that so that it's easier to get to, because I know that I have heard many times in the grocery store parents saying like, oh, it's just so far to go to the doctor that I just didn't make that appointment, or I couldn't keep that appointment because so much came up, or I didn't have transportation. So you could actually get your shots here.
That's correct. We have 2 medical doctors in the community who can provide that, along with family nurse practitioners who are certified to see all the way from birth, up into the older ages as well. And so, if you can find somebody locally that you're comfortable with, that you feel like you can talk to with questions and concerns, and I strongly encourage that. Now, not every nurse practitioner is certified to see pediatric patients. And so the one that you get with, you want to make sure is certified.
Right. So. And that's that point about someone you feel comfortable talking to. That is just such an important thing. No matter who your physician is, find someone you feel comfortable asking questions to. So I was surprised when I was researching vaccines for young children that there are some that are given before you even leave the hospital with your newborn baby. And I just never realized that. I guess it was something that happened, but I don't remember it. So can you talk a little bit about those vaccines and why they give them so young?
Absolutely. So, and actually it goes before birth. In utero is when we can start offering vaccines. So oftentimes in the 3rd trimester, and what's been around for quite a while is the Tdap vaccine, the tetanus, diphtheria, pertussis. And if it administered to mom in 3rd trimester of pregnancy, and so that's between like 24, 36 weeks of pregnancy, then that protects baby against pertussis, also known as whooping cough. more recently, so probably within the last year, they've come out with the RSV vaccine. And if that's also administered in the 3rd trimester of pregnancy, can give babies the antibodies as soon as they're born to help, protect against RSV. Now, in terms of birth, hepatitis B is the one that's administered ideally within 24 hours of birth, but before leaving the hospital. And that's been around for probably 35 years that they've been doing the Hep B vaccine before birth or right at birth. And then we continue that through the 2, 4, 6 month well-child checks as well. So.
Okay. So, and I think I mentioned those schedules are a little bit confusing to me. So, and I know we can give some vaccines together at a well-child visit, but how many well-child visits should there be before, say, a child turns 5?
Yeah. And so we have our standard guidelines that we follow. Now, after birth, typically, babies should be seen within 3 to 5 days after discharge from the hospital. So you want to, during pregnancy, have a pediatrician lined up or an FNP to kind of have that established and ready to go after birth. No shots are administered after you leave the hospital until about 2 months of age. That's when we offer the first one. And so typically we do 2 months, 4 months, 6 months, and then from there we extend out to every 3 months. So then 9 months, 12 months, 15, 18, and so on. And at each visit, your pediatrician or your FNP can kind of guide you along the lines of what to expect at that visit, what to expect at the next visit in terms of shots. And then, like you said, we group shots together at those visits to kind of make it more easy for parents, bringing kids in and getting them all done at a same time. Now, with that being said, I also wanted to mention that because we have a schedule of how the immunizations are preferred to be given, we don't have to necessarily follow that schedule. We do have flexibility with it. And so I know, like for me personally, 2 of my children were premature. And so I was very hesitant to give them all those shots at that first visit. And my pediatrician worked with us and we were able to split them up and administer them in a time that was comfortable for me. And so I tried to incorporate that into my practice as well.
Yeah. Well, and with some of the vaccine hesitancy that we've had in the past 4 or 5 years, and now parents may be saying, okay, I could do that. Is there a way to catch up if you didn't have your children vaccinated?
Yeah, absolutely. And again, it's just a discussion with your pediatrician, your FNP about, what is the best schedule of catching back up with these vaccines at a rate that's comfortable, for parent as well as the provider.
So you've mentioned whooping cough and diphtheria and tetanus. What are some of the other vaccines that our children get and what do they protect us from?
So I've got a good list here that I'm kind of excited to go through. And I don't know, hopefully we have time to kind of go through it if you want me to. I kind of have a shortened version of these, but we talked first about RSV. That's a more recent one. RSV is a virus that affects the upper respiratory system and into the lower respiratory as well. Babies are obligate nose breathers up until about 6 months of age. And so if you think about a baby getting sick, real congested in the nasal passageways, they can't breathe very good, and that can turn into a medical emergency. And so just in the last year, the RSV, we talked about moms in their 3rd trimester can get that. And so if you're currently pregnant, talk to your GYN about potentially getting that in the 3rd trimester. Now into birth, once the baby's born, we have hepatitis B that's administered right away. This is a serious virus that can cause liver infections. At that 2 month of age, we revaccinate with Hep B, but then there's also a Hib vaccine that protects against the Haemophilus influenza. This can cause ear infections, serious throat infections, epiglottitis. We don't see these very commonly today because of the vaccines that we've been doing over the last, many years. And so for a lot of people, it's like, well, we don't know the risks that are involved with not vaccinating because we're not seeing these. But epiglottitis in the past used to be a very dangerous illness. In addition to that, we have polio. vaccine, that virus can attack the nerve cells in the spinal cord, leading to paralysis. Again, we don't see that often these days because of the vaccine.
But I can remember pictures of my grandparents and all who had, uncles and things like that, great uncles who had polio.
Yeah, and then we have the streptococcus pneumococcal vaccine, which protects against pneumonia. Again, this is responsible for serious ear infections, throat infections, pneumonia into the lungs. You might look at immunization records from your kids and you can see, well, my kid was vaccinated with Prevnar 13, maybe a little bit older or younger of a child vaccinated with Prevnar 15, because that vaccine's evolving. And so now today we're vaccinating with Prevnar 20.
Oh, okay.
And so, just if you look at the immunization records and you see a little bit difference in the number of that vaccine, we're coming out with vaccines that are more inclusive of different strains. In addition to that, we have the rotavirus. This is the liquid that's recommended for babies to take. So rotavirus is a virus that can cause GI upset, severe diarrhea, which can easily lead to dehydration in our infants.
Yeah.
And that one's recommended up until 6 months of age. We don't offer it after that time range, usually 6 to 8 months of age, we don't offer it anymore. We have DTaP. This one combines several different immunizations. Diphtheria, this is a serious infection of the nose and throat. Tetanus, we often know this as lockjaw, but it can cause painful muscle spasms and death. Pertussis, we talked about that with the whooping cough. And so those are our basic immunizations up through 1 year of age. And there's multiple immunizations that we split up throughout that 2, 4, 6, 9 months of age visits. Once we turn 1, then we start introducing the measles, mumps, rubella vaccine, varicella, which is chickenpox. Now, when I was young, we didn't have the chickenpox vaccine. We all went through chickenpox. And that virus that causes chickenpox is the same virus that causes shingles as we get older. And so if you've had chickenpox, very likely you're going to get shingles when you get older. And so I think that's something that the younger generation won't have to deal with because, we're vaccinating against it now at a young age. In addition to that, we have hepatitis A, again, another liver infection, easily prevented by the vaccine. And then once we get a little bit older, at 11 years of age, we start offering meningitis vaccine, and then we have the HPV vaccine to protect against cervical cancer. We often think of this as a female vaccine, but it's also recommended for the males as well.
I just recently read that and I was surprised by that. I've also been hearing a lot about measles appearing across the United States. And so it's not because the vaccine's not working, but it was because probably we didn't get vaccines during that time, those couple of years there where our medical people were stressed and we didn't want to go to the doctor.
And that actually started before COVID. I know we've seen kind of an increase since COVID as well, but I don't know if you remember kind of an anti-vaccine era that kind of came around between 1998, 2005, in that range. There was a British physician by the name of Andrew Wakefield who came out with a report saying that vaccines were linked with, or specifically the MMR vaccine, linked with autism. I don't know if you remember that report.
Right. I do remember that.
And so I think rightfully so, parents just kind of were like, whoa, wait, we may need to take a look at this and kind of see what's going on. And at that point, we saw a decrease in vaccinations. And then I think we started seeing increased cases of measles because of that. But I did want to point out that about 10 years after he came out with that study, it came back out that he had falsified information.
Oh, no.
Had you not heard that?
I had not heard that.
Yeah, he had falsified information. He was paid to falsify that information, and that there's no correlation between the MMR vaccine and autism.
Oh, wow.
So, yeah.
That is something that we had not heard. That's interesting how sometimes the other side of the story doesn't get back out or with the results of something.
But you're right. Again, with COVID, we saw another decline in vaccines, more from the sense of parents didn't want to go expose their kids in a doctor's office. And so they fell behind on those immunizations.
Well, and, I hesitated too. Do I really want to go to the doctor right now? So I can understand that. The other thing I thought it might be nice just to inform parents, sometimes some of us moms, we worry about the pain our kids will be in when they get their shot. Sure. And what are some things we can do to minimize that?
Sure. So oftentimes I'll offer parents a dose of ibuprofen or Tylenol prior to immunizations. Now, kids under the age of 6 months, only Tylenol. We don't do ibuprofen. But older than 6 months, we can offer ibuprofen. Now, guidelines have kind of gotten away from doing a pre-dose of Tylenol or ibuprofen, just because there is some studies that show that immune response isn't quite as robust when we do pre-dose with Tylenol or ibuprofen.
I did not know that.
And so, but if you have a child who's very sensitive to pain, then by all means, I recommend let's give them a pre-dose to make sure that they're not going to be super uncomfortable after the vaccines. It's very common to run a low-grade fever, I tell parents, after vaccines. No need for Tylenol or ibuprofen unless child is just really uncomfortable. Now, something that I definitely recommend, injection site, kids get really sore, warm compress to that area, gentle massage. I tell parents, let your kids have a fun bubble bath that night and just kind of soak in a warm tub, and that can really help relieve a little bit of discomfort.
Okay, that's great to know. I would have thought ice, so warm. So I probably did that wrong. But that's good. And I know another thing, you mentioned shot records and reviewing your shot records, and now everything's sort of electronic, so we don't have those little cards anymore. So can you tell people how they can find their shot records?
Yeah, and so I still see those cards come in through my clinic. They'll give them at birth at the hospital, and if parents want to have that paper documentation, bring it in. We'll fill it out in the clinic. We'll keep that up to date. But everything is through NMSIS, which is the New Mexico immunization system, and there's actually public access to that. And so if you want a copy of your child's records, you can just go through the New Mexico Department of Health, the NMSIS system, and type in your child's name. It'll pull up their records if it's been administered through New Mexico. And so that's one way. Also, you can go through your primary care provider or pediatrician's clinic, and they can get those records for you as well.
Oh, that's great to know. Yeah. I mean, it's so easy for us to access. We don't have to go ask the doctor for it. If we're thinking, oh, is it time or whatever.
Right. And something to consider, though, if your child was vaccinated outside of the state of New Mexico, those do not cross over into New Mexico. Right. And so we have to request those records from wherever they were administered so we can get them updated in our system.
But then you can update them in the the electronic system. So that's great news. I think we're almost out of time, so we usually do some food for thought here at the end. And I found this quote about vaccines, and it says, vaccines are the most cost-effective healthcare interventions there are. $1 spent on a childhood vaccine not only helps save a life, but greatly reduces spending on future health care. And that's by Ezekiel Emanuel. And I thought, wasn't that appropriate for what we were talking about today? And you even mentioned the one that, you have this little vaccine and you can prevent cancer in the future. But just even our other healthcare issues like, the polio and things like that, which were not only deadly, but very
debilitating.
So very, I thought, a great way to end our thing. We do have a gift for you today. We appreciate you coming to be on our podcast. We have a Health IQ mug.
Thank you.
Or actually, they're called tumblers, aren't they? And we want to thank all of you for joining us today for this episode of Health IQ. Come back next time as we discuss ways to be prepared for the brutal summer heat that we will be experiencing soon.
Special thanks to our guest contributor, Lindsy Foust, a family nurse practitioner of the Presbyterian Medical Group. Our host was Brenda Bishop. Our podcast crew, director Robert F. Hockaday. Producers were Robert F. Hockaday, Joyce Runyon. Video crew was Joyce Runyon. Music provided by David Morris.
This podcast was made possible by a New Mexico Department of Health Better Together grant. Additional information about today's topic will be on the Health IQ blog located on the Quay County Health Council's website at www.qchealthcouncil.org. Be sure to follow the Quay County Health Council on YouTube, Facebook, and Instagram at Quay County Health. This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.